We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the podcast this morning. It's a snowy morning in Salt Lake City, Utah. We're so excited to meet with our guest here today, Dr. Lee Dibble. We are talking about rehab to lifelong wellness. And we're not just talking about, just strength training or endurance training or rehab. We're talking about just overall wellness, getting real deep into this and reimagining the physical therapist's role. Lee Dibble is one of my professors from physical therapy school. He is internationally renowned. I'll just give a brief introduction to him. He's the professor and chair at the University of Utah. He's a PhD trained movement scientist, and he's internationally recognized leader in neurologic rehab. He's had over 100 peer-reviewed publications, and he's pioneered a lot of the work with balance, fall risk, Parkinson's disease progression, and his research has really shaped so much of clinical care and what we do in development models, like the LS Skaggs Wellness Center, building bridges to wellness. And he's influenced, I want to say thousands of physical therapists, but he told me hundreds. So I'm so thrilled to have Lee on the podcast. Such an honor. So welcome to the podcast.
Well, thanks for having me, Brad. It's an honor for me to be asked to do this. And I'm really excited about the opportunity to talk to you about something that's kind of a deep passion for myself.
Yeah, I remember sitting in class in, what class was it? We were up at the University of Utah, neurologic rehab.
Yeah.
That was the class you taught. I forget what it's
probably
called.
Neuroanatomy.
Neuroanatomy, yes. Yep. And you got up. It was the first 10 minutes of class, and I felt you got on this soapbox, and it was such a powerful soapbox. It had such a deep impact on me that I saved the article that you talked about on my desktop, and I read it so frequently, and is one of the biggest things that I cover with my therapist today. And the article was titled, "Physical Therapists on the Front Lines, but Not Engaged in the Battle." Tell us about this article.
I wrote that as an editorial for a special topic issue on wellness in the context of neurologic rehabilitation. It was for the Journal of Neurologic Physical Therapy. What we wanted to really talk about was the fact that our job as physical therapists cannot be considered to be done upon discharge from insurance reimbursed care, particularly in the context of neurologic disorders, Parkinson's disease, multiple sclerosis, but stroke, spinal cord injury, other neurologic diagnoses. Because those individuals, whether acquired or from an injury or even someone that has a congenital neuromuscular disorder, that's a lifelong issue for those individuals. And we as physical therapists are the people that can have the most impact about them, those individuals having the opportunity to take an active role in the management of their disease or their condition and to fulfill and live life fully. I mean, when we talk about wellness, there's a bunch of different components to wellness, but certainly physical wellness and social wellness are two critical factors. And if we can make a person more functional physically, they can get out and engage with their community and engage socially. So we're contributing greatly to their overall sense of self and the definition of health.
Yeah. I mean, this article stews up so many thoughts that I've had through the years and gives so many answers too. Tell us about all the different facets that you're thinking about when we're talking about overall wellness for all people.
Yeah, I probably am going to leave some things out here. I can picture a wellness wheel that I've seen, a graphic that I've seen previously that includes physical wellness and social and community, but also spiritual wellness and financial wellness, other things. And we're physical therapists. We're not going to contribute to all of that, but I think we should acknowledge that, our role in that kind of niche area of physical wellness may form a foundation for other aspects of wellness. And we need to certainly acknowledge those as an individual is interacting with us during a confined episode of care.
Yeah, especially, the physical therapists, we go through this episode of care, whether it's for a neurologic patient with a stroke or Parkinson's disease, we help them progress through phases.
Yeah.
In orthopedic clinics, we're working on getting their pain better to be able to do a certain activity. Yeah. But what's the next step? What is, what else are they limited in wellness overall? Are they limited in social interaction? Are they limited in financial education, right? It's not our job to necessarily teach, this social interaction, but what can we do to help, right? You were immensely part of my mentorship as I worked on starting a boxing program at the University of Utah.
Yeah.
And I loved this program. I don't know if you know about how I got engaged with that, but essentially I walked up to Amy one day. I was working in the wellness center before it became LS Skaggs
Right.
Wellness Center. It was in the basement of the PT school, and I was checking in people with Parkinson's disease that were coming to this wellness center to work out. But I was recognizing that all of them were really coming for social interaction, and there wasn't a lot of physical work going on, right?
Yep.
You know what I was talking about?
Yep.
And I personally was getting a little bored. It was a little selfish, but I went up to Amy and I said, Amy, I need something else. I need something to really sink my teeth into, because I'm losing some passion here and I'm a little bored. Can I do any projects or do anything that could get me excited? And she said, well, we've thought about starting a boxing program. Would that be of interest to you? And I'm like, absolutely.
Teeth are already sunk in, right?
I know nothing about boxing, but I will take on that project. And I had a leadership capstone project that I was doing for my leadership undergrad.
Yep.
And it was, like I said, the capstone project of the whole program. So then I got a grant through the program to be able to get $1,000, which I thought was an immense amount of money. And I went and purchased all this boxing equipment and convinced 3 people to start. And, that's where it all started. But what changed is that they were working hard and they were getting social interaction, right? So physical therapists, sometimes we think, oh, well, that's not my role. My job is just the physical.
Yep.
But how can we get people to be socially interacting, right?
Right. I came to this kind of focus through kind of a Parkinson's disease route. And one of the things about Parkinson's disease, from a disease process itself, it contributes to a sense of apathy and a sense of depression that can be organic to the disease. So one of the challenges for those individuals is that if I'd say, you need to exercise, that's not going to sink in the same way that it might for others. And others have a hard time with it. But we should just expect it's going to be even worse for people with Parkinson's disease. I think that applies to people with any acquired kind of condition that they're going to have to live with chronically. We shouldn't assume that we can just say, hey, go do this. We need to provide a way and an opportunity for them to be engaged with it, because you and I both know that even for ourselves, we're not going to do it if we're not engaged by it. We've seen it in boxing. We've seen it in a dance program. We've seen it with some of our current research looking at cycling programs, that yes, there's physical benefit. And that's one of the reasons we're trying to do that, to improve physical function and maybe neurologic function. But equally, or potentially more importantly, is the sense of community that the individuals get and the social exercise that they get from interacting with other people that are dealing with some of the same issues that they're dealing with.
Yeah. Tell us about, at one point we had boxing, Tai Chi, yoga, ballet bar, dance. We had all those 5 programs at the LS Skaggs Wellness Center. Tell us, what difference have you seen that make over the years for these patients?
I think I would start with certainly the individuals with the disorders. And I'm just going to pause there and say, I have to correct myself in this. I want to demedicalize those individuals. I try not to call them patients.
Yeah.
I'm saying, okay, you're an individual with Parkinson's
we used
disease.
to call them participants, or like, these are just people.
Yeah. So
these are not patients anymore.
Yeah, we're outside the medical system, trying to provide these in a way that these situations and opportunities in a way that they can sustain them.
Yeah.
And so it's not like a copay based kind of phenomenon or anything like that. We want to demedicalize it. So I just try to check myself and make sure I'm not calling them patients.
Yeah.
But it's a constant battle for me.
Absolutely. So what do you feel these programs? How do you feel like they've made a difference for these people?
Certainly for the individual, there's physical benefits. There's no reason in most of these disorders that we're talking about, conditions, that they can't benefit from a musculoskeletal standpoint, from a cardiovascular standpoint, from an autonomic standpoint, from a neurologic standpoint. So there are multi-system benefits from a physiologic standpoint. But there's also the opportunity to socially interact with other individuals, to have a sense of self-efficacy, that I'm not just taking a pill and passively a victim of the disorder that I have, but I'm taking an active role in helping manage this, that I'm as important as the physician or medical provider giving me medications. And that's just for the individual with the disorder. Then we've got care partners, that the opportunity for the care partner to maybe participate in some of those things and get some of the same benefits, or that maybe it's just respite, that they can, they're not responsible for that individual. They come to the LS Skaggs Wellness Center, and we have students that are helping guide those individuals through their routines. That care partner has the opportunity to take a deep breath. And I've sat and watched this kind of self-organizing support group develop amongst the care partners sitting in the waiting room. It's a thing of beauty. And then going to the students. I mean, to me, if I can get a student thinking about rehabilitation and physical therapy beyond insurance reimbursed care and the kind of limitations that imposes on us, I'm very happy. My job is almost complete, because we're going to educate them about how to provide care for an orthopedic condition or a neurologic or cardiopulmonary condition. But oftentimes those conversations are presented in the context of the medical model and insurance reimbursed care.
I love all the lessons that I learned as a PT student. And I wasn't the typical PT student that was just all academia. I wanted to be involved in everything. And I wanted to take the pieces that I learned in the classroom and go apply it the same day. Yeah. And I was, leaving class, and I was going over to LS Skaggs Wellness Center and starting the boxing programs. Yeah. And I think we had calculated over the 4 years, or the 3 years. No, it was 4 years, because I started in my undergrad. Yeah. We had over 300 volunteers within that time period. Yeah. That was a lot of people that were influenced, through those years. And the lessons that I learned as I ran those programs has stuck with me forever. And I loved the faculty's approach to giving me that stewardship, because no one ever managed me. Yep. You guys gave me resources, but you're like, you're doing awesome. This is great. Keep going. Right. And it was never like this job. I didn't get paid to do it. I just loved doing it. And I love the impact that we're making. I made such close friends with and I just want to paint the picture for those that are listening to this. Imagine a little old 85-year-old gal punching some boxing bags.
With pink boxing gloves, mind you. I have that same image.
Like a room full of these individuals that have Parkinson's disease. They had strokes. They had multiple sclerosis, like these not so fun neurologic diseases that you did never want to have. Yeah. Right. And then you have these group of physical therapy students. We actually recruited a bunch of the boxing team. So I joined the boxing team. I don't know if I told you this, but I joined the boxing team. I never boxed in my life. I told them one thing, just don't hit me in the face. I've had too many concussions. But in anything else, you can hit me anywhere else, right? But I joined their team, and then I made friends with them, and then I recruited them to come help me because I didn't know what I was doing. And then it was this collaboration between the University of Utah boxing team and the University of Utah PT students. So we had all these students and these boxers that came together and said, let's create a program collectively as one, right? And that's what this is all about, is this team-based approach in healthcare of how can we work together as a team. We're on the front lines, but are we engaged in this battle?
Yeah. And part of that article, to bring it back to what we've started talking about, was certainly the kind of wellness programs. But when I kind of made that statement, we're not engaged in the battle, it doesn't have to be directly offering a program. It could be advocating for better reimbursement for individuals with chronic diseases. It could be advocating for community resources that are being available. I was trying to just provoke people, honestly, to be engaged in some way. I can't choose for you how you're going to be engaged, but I want you to be engaged, right?
Yeah, absolutely. And I just want to give a few tips here, and I'd love for you to add to these tips. Something that we do in our practice is we have a practice liaison that's going out actively and connecting with every gym within a 5 to 10 mile radius of every clinic, because we want to know every personal trainer. We want to know every workout program. We want to know how it's programmed, right? And as I talk about these things, I'm thinking about me as a physical therapist listening to this. It doesn't mean I've memorized every one, right? I'm the expert, and I know my resources within my geographic region of my clinic, right? I don't know everyone in the valley, but I know my people well. And I know what gyms certain people would do well in. I know what gyms they would not do well in. But essentially, I have this database of all these trainers that I've personally connected with. I've gone to their gyms. I can't tell you how many gyms I've gone to just to try out what they're doing. So that way I can connect patients with those people. All right, so that would be one tip I would recommend to any provider, not just physical therapists, is like know your community resources so you can know when to refer people to. And they'll do the same. They'll refer patients to you or people to you.
Right.
And so those are just a few tips that I've learned over the years to connect. You got to know your resources. What other tips do you have?
Yeah, I mean, one of the thoughts that comes to mind is from a neurologic condition standpoint, there is some concern sometimes that a person gets a referral to a physical therapy clinic that's focused on musculoskeletal disorders. And one of the PTs says, well, I can't do anything. Okay, that really frustrates me, to be honest, that we should all have knowledge, regardless of our practice setting, about trying to be able to provide some benefits.
Absolutely.
But then kind of extend that beyond that we are providing care predominantly in a tertiary prevention type of model, meaning the person gets diagnosed with something, has a condition, or has a functional limitation, they're coming to us. I would like us to broaden out our perspective to really be thinking about it, at the very least, secondary prevention. That if you're seeing a patient for or have contact with an individual with a particular disorder, maybe they're going to have a knee surgery, but they also happen to have multiple sclerosis. Could you find that personal trainer at a local gym that you trust to get that person conditioned in preparation for some procedure? And then from a physical therapy standpoint, we could offer that care after the condition that they might need.
And that's the engagement we're talking about, right? Identifying the need.
Yep.
You are a skilled musculoskeletal, neuromuscular, like we're trained on all systems.
Right.
Just because you do orthopedics doesn't mean you can't do neurologic, right? And we got to remember that just because we were up in PT school up on the hill, the University of Utah, and we had all these resources, and there's neurologic and orthopedic, and everyone works together as a team. Down the street, it's not the same way. If someone lives out in Harriman, there's not a neurologic specific specialized PT out in this region. So we got to be okay with seeing these conditions that we don't see every day, because these people, they don't have the availability just to drive an hour every, multiple times a week to see a therapist. So if we're not willing as a PT to see these more rare conditions that, and I shouldn't even say rare, they're not really rare. Like these are all things that we learned really well in PT school. But refresh your notes. Let's get to we are, especially here in Utah with being primary care providers. We need to be primary care and treat all these conditions. And yes, if we can get them to a specialist that helps them and is close to home, that meets their needs, great. But if you're all they have, please be that person. Don't turn them away. Don't say we can't do that. Like there's so much value you can provide for them. More than 98% of the population of people. And if you're not helping them, who is?
I mean, I think to me that some of that comes in the definition of health, right? That I think sometimes we as physical therapists and other individuals define health as the absence of a condition or disease. That is not health. An individual with osteoarthritis like myself, I view myself as healthy, right? I don't have other chronic conditions that I have to tend with. The other aspects of my life, I think, are going well. I think that's what we should strive for with any individual that we're seeing, is to try to help them be able to define their own sense of health and don't turn them away because we don't feel as comfortable seeing them with that disorder versus maybe a musculoskeletal disorder.
Yeah, I really like what you're saying here. You've kind of alluded to it. How do you define health, and why does that definition matter to both providers and to patients?
I'm going to have to take a second to think about that.
I mean, it's all encompassing, right? Like, because providers, we learn in school and we get so attached to what you were saying of, the absence of disease. But if we're really working on the front end of this and we're talking about prevention of disease, medicine 3.0, right? Like we're working in a different standpoint, a different mindset. Like I saw all these neurologic conditions in school and I decided I want to focus on the front end.
Yep.
I want to completely get people to never have a stroke, right? How can I focus on being in teenagers, in schools, in early in life, get people motivated to do the things and be healthy so they didn't develop those things later,
right? I think the mainstream medical entity has come around to the things that physical therapy has thought about and been about for decades now, probably in its entire existence as a profession, that physical activity and exercise are critical to the overall definition of health. That not everybody has to go out and run a marathon or anything like that, but to be able to be actively engaged in your life, to do the things that you want to do. If your children have children, to be a grandparent and do those things with your grandchildren, or to go out and be able to partake of the beautiful outdoors that we have here in Utah, or walk with friends, or just be able to get out in the community. Those are all kind of encompassed in that definition of health. And I think I used the term a little bit ago about self-efficacy, the belief that you have power to be able to influence how you're functioning.
Yeah.
And that's probably core to my belief of if a person feels healthy, regardless of their physical condition or the diagnosis they have, if they feel like they have control over their condition, then they probably are trending towards healthy in their own minds.
Yeah, we had about 50 of us in a room at rounds one day, surgeons, NPs, PAs, and we had this discussion on locus of control and how it influences pain. And the more people had self-efficacy, this sense of feeling like they had control, the less pain they had overall. And it was really interesting to me as we had this discussion is people, certain demographic populations that didn't have control had significantly higher healthcare costs. They had significantly higher pain levels, pain perception, right? There's just so much negative impact that comes when you don't feel you have control over your life.
Right. So let's pull this back to talking about PT, though. Mm-hmm. Again, we're on the front lines to be able to interact with individuals with disorders that come to see us. And we are probably the best care provider, given the amount of time we have with individuals, to be able to foster that sense of self-efficacy. To be frank, a neurologist that's seeing somebody with Parkinson's disease, they have 15 to 20-minute visits scheduled. Or maybe I might be exaggerating, but it's really time constrained. So they have the opportunity to talk to them potentially about their medications, maybe in passing about physical activity and exercise. But if they come to see us, then we have an extended period of time to really delve into not only what they need from a physical standpoint, but what other aspects can we provide benefit for that individual.
Absolutely. And you think about the PT is really right there. We'll talk about their knowledge and what they learn in school here in a minute to really set them up with enough tools to be able to do this well. But you even think about the episode of care. If you're seeing a patient for 2-3 months, how well do you get to know them? Right? How well do you get to know someone in 15-20 minutes? Yeah. Right? They're not going to spill out their whole life's desires in 15 to 20 minutes, but you can bet your bottom dollar in 2 months that they are going to share just about everything. You're going to get to know them extremely well, so you can help them develop an entire plan that can completely, drastically change their life.
Yeah. Yeah.
Tell us about the tools that PTs learn in school that prepare them so well to be able to have these conversations and serve these people at that level very well.
Yeah. I mean, to just follow up on something you just said, that we have the opportunity over an extended period of time to interact with individuals. That's a privilege and a responsibility, right? That we really want to be able to understand those individuals on a personal level and what challenges they may have that may be obstacles to their overall health. So I view it as a responsibility, but also the opportunity to really make a meaningful impact in that person's life. So that's a privilege that I think, because of the structure of the medical system, that physicians and other medical providers don't really have.
And they're so constrained, and there's so many things they have to do in that 15 to 20 minute visit too.
Yeah. To follow up on your question about what tools physical therapists have, I mean, certainly an extensive knowledge of the pathology and the anatomy associated with particular disorders. But also some of the things that I think are most important is a knowledge of the biopsychosocial model of care. That if you're just trying to focus on physiology, you will not get your patient completely better.
Break down biopsychosocial for those who don't know that word.
Oh, dang. I know you were going to ask me that. Now I'm going to have to try to come up with it. I mean, the biologic is certainly the physiology, and we have to attend to that. But the psycho is the psychologic components. It goes back to something you were talking about earlier. If the person, doesn't have a locus of control, or is depressed or apathetic, or that has other things happening in their life, those are going to be obstacles to them improving from any physiologic intervention that we have. And then the social aspects. What are the social determinants of health that they're contending with? Do they have access to regular other health care, primary health care? Do they have food insecurity? Do they have a social network that provides them support? All of those things are going to affect the outcome of whatever treatment that we provide.
Yeah. I have so much heart for what you just said. This is why I love our profession. These are the in-depth things that we're trained so well on that can make such an impact on the world.
Yep.
The biopsychosocial framework is really medicine 3.0. It's knowing all aspects. And that's why we're positioned so well to be in a primary care role, is because we can help lead those efforts. We understand all of those components. I just did a podcast with a psychiatrist talking about ACEs and the importance of keeping in mind ACEs and how it relates to pain.
Yeah.
That was all covered in school.
Yeah.
We literally had an 8-week course from a psychiatrist in school,
the
understanding
the psychology of disability, right?
Understanding these concepts and how it relates to disability, pain, and helping people live the life they always wanted, right? So you think about this broad spectrum that PTs have and how it can literally create so much value for people. We are literally set up so well to serve so many people with so much value that I wish everyone knew that.
I think we have to be engaged, though. I mean, I do believe the profession sometimes chooses a passive role. And it's hard for me to be self-critical of our profession, but I think it's sometimes we're set up in a medical model where we feel dependent on referrals from providers, and that's the way that we kind of provide care and make a living. But to your point, we have the opportunity to be engaged at the initial contact with the medical system also. I mean, what my goals would be in individuals with neurologic disorders like MS and Parkinson's disease, maybe even vestibular disorders, is that that if they happen to see a primary care provider, like a medical primary care provider, that at the same time that individual gets a prescription for of medication that might help manage their condition, they get a prescription for rehabilitation. That
how it should work.
Yeah, that's how. I mean, they should be handed to the individual concurrently. There's not a sequential, like, this is more important, these are the meds, this, oh, by the way, do this, that these are critically important for both of you. We were talking earlier about a neurologist that treated my father-in-law, and as his dementia was diagnosed, the neurologist said, I need you to get social exercise, I need you to get physical exercise, and I need you to get cognitive exercise. In my mind, that's an enlightened neurologist. That was like saying, okay, I can only do so much for you, but here are things that you can actively do for yourself. And you and your care partner should actively engage in these things. And this is going to maximize the outcome from what you're dealing with.
Yeah, that's absolutely brilliant. And kudos to that neurologist for jumping in there and explaining medicine isn't the answer.
Yeah.
It's a piece.
Yep.
It's a piece of what we need to get to the next level. I just read a study this morning that said, quote, physical exercise is 50% more effective than mental therapy and medicine alone. And I didn't dive deep into this study, but I mean, you can't not agree with that, right? With what we know about exercise. I don't know all the specifics and the quotes and all that, but ultimately, there's so much truth to that. Exercise is the best medicine.
Yeah. I mean, I have these conversations with people about exercise and the value in the context of neurologic diseases in particular. And I always preface it by saying, you need to realize a physical therapist is talking to you. If you're looking for somebody with an unbiased view of physical activity and exercise, you came to the wrong place.
Not the guy.
I'm not the guy. Go find somebody else. That I'm going to admit my bias up front. I have a biased view of exercise, of physical activity, and the value it has for anyone. And you're going to have a hard time contributing to changing my mind. An individual with Parkinson's disease or MS or another disorder, the dogma in the past, I mean, the 70s, 80s, 90s, was that if a person is diagnosed with a chronic neurologic condition, that they should just go sit and not do things. There were smatterings of studies in those decades that were suggesting otherwise. But I would really credit one of our former faculty members, Dr. Ed Gapmeyer, who published seminal work in the mid-90s with a neurologist colleague at the University of Utah that had people with MS doing aerobic exercise. And not only did it improve their physical function, it did not increase exacerbations of the disease. And since that time, those findings have expanded to other diagnoses. They were certainly kind of foundational for me to think about it in the context of Parkinson's disease, but I think they extend to aging, but also other neurologic diseases. If we can maximize the condition of the peripheral musculoskeletal, peripheral cardiovascular system, the autonomic system, the person with any disorder is going to function that much better.
Yeah. Absolutely.
And at the very
I
least,
love Ed's work there.
Yeah.
I mean, if you know Ed Gatmeyer, I mean, so much respect to that man, because that was groundbreaking research that we've literally built our profession off. That's where a lot of it started, because we believed that exercise with multiple sclerosis was negative. It had such a negative impact.
Yeah.
But we found that the dosage is the most important part.
Yeah.
But exercise was the best thing that they could be doing. But how we applied that was super important. I want to go back for just a minute and talk about this engagement with PTs. What pieces of advice would you give physical therapists to be more engaged? What would you say to both the rising generation of physical therapists that are entering the profession, and maybe some that have been veterans that are been passive for years, that don't know how to get engaged? What tips would you give them?
I think we all need to identify a passion. That if I was to say, Brad, you need to go do this, you need to go do legislation, and you're like, oh my God, that sounds like punishment, you're not going to do it. But if we can work together, if you can find something that you're passionate about, maybe it's community service, maybe it is, I've often thought that I should be more engaged in hospice physical therapy, because I've had events in my life where people had terminal illnesses, and what a dramatic effect that we could have for a family at a critical time in their life if we were a physical therapist in that setting. So finding a passion that excites you because you have a great deal to offer, and doing some soul searching and reflecting about what those things are that really excite you, and you feel like, okay, I have something to offer here. I'm not sure if that was as specific as you wanted me to be.
That's brilliant, because we do the same thing with patients, right?
Yeah.
When I strive to build this bridge from the patient of end of episode with insurance-based medical model care, and I want to build a bridge to optimal health, this is what I'm thinking about. I have to know the patient. I have to know their passions. I have to know what excites them. If I just say, well, this CrossFit is going to be perfect for you. But
is that like 1% of your population?
Yeah, like this little old lady that just wants to go do some Pilates.
Yeah.
She would thrive in a Pilates studio. But I'm placing her in the wrong environment.
Yeah.
She's going to think that exercise is not for her. Right? But if I know the environments and I know the people, then I can put them in the environment that are going to thrive the most. So this is what you're saying with our physical therapists. And let's just blanket statement for all of healthcare, right? We are talking about PTs, therapists being engaged in this battle, but we all got to work together.
Yeah.
But essentially you're saying, find your passion.
Yeah.
Find a way to be engaged and chase that passion.
Yeah. One thing that you and I have talked about previously is burnout and the concerns that some rising students or clinicians have for burnout. To me, the antidote for that has always been doing something you're passionate about. If you're doing something you're not passionate about, that is a recipe for developing burnout. But if you have passion about what you're doing and you're energized by what you're doing, burnout is an afterthought. It's not something that's going to occur, because you derive energy from the things that you're doing.
Yeah, absolutely. And just a few additional thoughts there. There's so many different ways to get engaged. You can get engaged through developing community programs, with your own clinics. You can develop community programs for a broader group, right? We set up the wellness center, the LS Skaggs Wellness Center, and that was a whole project on its own. The fitness classes were something supplementary.
Right.
I just wanted to do a project as a student.
Right.
And then they developed into so much more and served so many people. But those were just those programs, right? And they, some continue, some didn't. But ultimately, they serve people, right? And it was a passion for me at the time. And it taught me how to develop these programs in the community more. And now I'm involved in legislation, which is actually really boring to me. But the reason I'm passionate about it is because I care about my profession so much and our future. Yeah. And I'm not really good with legislation that much. But what I'm really good at is knowing my resources in the community and connecting people. And I don't really stop. I have a lot of energy, and I'm like, I need this person on board. I need this person on board. And I just get everyone together and they figure out the solution. You know what I mean? And that's my strength, and that's my way to engage.
Yeah. I mean, I was going to comment that I would argue that you probably are good at politics because you're good at people.
That's fair.
That you're a people person and you enjoy talking to people and getting people together. And at least half the battle in these political kind of arenas is getting to know the important players and trying to put them together to solve a problem.
You are correct there. I guess I'm alluding to more of like the writing up the legislation. I read those and I'm like, immediately want to go to sleep.
Well, that's for the lawyers to do, right?
You are correct. I mean, legislation is a lot of politics.
Yeah.
In politics is people and connections. Yeah. And what I've realized is, there's this negative connotation to politics so much, but those legislators really deeply care.
Yeah.
They really want to make a difference. Most of them have worked in healthcare before. They've been surgeons, been doctors, and now they're representing healthcare on the political standpoint because they want to protect the essentially healthcare of Utah. And they're so supportive of everything that physical therapists are doing because I believe this biopsychosocial model that we've done so well with treating the human being, not just a total knee replacement or an ACL reconstruction. We take the human in mind that has a heart and a brain and feelings, and we help progress them to where they want to be and help them live truly the life that they want. Not just get their knee range of motion better. We're getting them to kneel to be able to play with their grandkids. Right. These really important pieces that are going to help them thrive. Any other thoughts before we kind of close the engagement portion?
Yeah, I mean, I don't want people to think that the LS Skaggs Wellness Center is the only entity nationally that does this thing. There are examples in Denver. The Anschutz Medical Center has a wellness center. In Birmingham, Alabama, the Lakeshore Foundation is a wonderful kind of resource for people that have had acquired injuries. It's one of the Paralympic training centers. There are people around the country that are doing really cool things with programs like this. And I think my goal would be to have that available in every community. That whether it occurs at a clinic-based level, like a private practice clinic, or a community rec center, or a tertiary care medical center, I don't think it matters. But if we can create community-based resources for individuals living with chronic diseases, the medical system and the community are going to be better because of it.
Yeah, absolutely. And what better center than a physical therapist to help out with those programs?
Without question.
Like we can structure them. It doesn't mean you have to be physically the one doing it, right? Like we had 350 volunteers, literally people that showed up to volunteer their time because they wanted to make a difference, right? And it didn't take a lot of my time as a PT student. I just got on a group text and said, hey, you want to come? This is when to show up. And I do some brief trainings before on how to do blood pressure and how to manage vitals. Yeah. And then we just said, this is station 1, 2, and 3 and go time.
Right.
We're talking like 3 hours a week of developing this very comprehensive boxing program, and then eventually Tai Chi, yoga, ballet bar. We had one course instructor. We advertised it in the clinic. People came, and then they told all their friends too. It started with 3 people, and then all of a sudden, I think at one point we had like 25 participants. We're in the hallways doing ladders. We're like out in the courtyard doing stuff. Like it was a snowball effect because people wanted to serve people, and then these people that were being served were giving back to me too. They were giving me gifts for when I had my baby. Like literally my daughter has this thing on her wall. It says Emerson, and it was Sylvia Mathis. Yeah. She literally hand drew this thing for my daughter when she was born, and she literally has it in her bedroom to this day, right above her on her wall.
One of the most striking memories I have of the early days of our Parkinson's program was one of our students was getting married, and a person with Parkinson's disease who had had Parkinson's for a long time and had a really quiet voice. And, you could hear him, but he wouldn't really project just because of the consequences of the disease. He was of Scottish heritage, and Fred was his name. He walks in to talk to Reuben and finds out he's getting married, and he's like, I have a song for you. And he belts out this Scottish wedding song with such kind of vigor, and it was the emotion of trying to support this person that had helped him. It was a thing of beauty, and kind of brought tears to your eyes when it was happening, because he'd walk around kind of a little bit hunched over and a quiet voice because the consequences of the disease. But he was like, this was something that was meaningful to him, and he wanted to be able to share it. So that kind of sense of community that was built between the individual and the students was mutually beneficial, right?
Yeah. It's quite an emotional experience when the semester ends.
Yeah.
For everyone.
Yeah.
Because it makes an impact, because you're serving one another.
Yeah.
And these people are so gracious and so grateful for all those students. But I want to really cover this last topic as we kind of wrap things up. You're one of the best specialists, I would argue, in the world when it comes to vestibular. We're talking about balance disorders, fall risk, things like that, because of your Parkinson's disease background. Tell us, what should the public know about fall risk and balance disorders? What advice would you give them? I know this is very general, but what should they know?
Dizziness and imbalance, I don't think, are natural consequences of any disorder or aging, and that if an individual is having difficulty with those kinds of things, they should seek out care. Some of the most common causes of dizziness in the community are readily treatable by a physical therapist, something like benign paroxysmal positional vertigo. Like, we're one of the specialists in being able to provide that care. And if a person gets to us quickly, it's minutes of treatment, and the thing is taken care of.
I'd see people so I worked in the emergency room.
Right.
And I was just on call.
Yeah.
So I was working upstairs, and they just call me when these things would happen.
Right.
So I would treat acute low back pain and dizziness.
Yep.
And I'd come rule these things out. People would come in, think they were dying.
Yeah.
And they think they need, there's a medical doctor or some neurologist to come solve their issues. And we'd go in there, 3 minutes, we'd do our thing. And sure, there would be other sessions, but we'd take away 90% of their symptoms within in those 3 minutes.
Right.
And it was amazing.
Yeah. And an imbalance, certainly a fall and an injurious fall can be a really significant harbinger for other medical issues happening in the future. So if we can see somebody that's trending towards frailty and fall risk, that's an area that I think we need to be involved in primary care and primary prevention. Like, we could do grip strength screenings. There's a lot of data that supports that a person that has impaired grip strength is kind of trending towards frailty. And is that person at fall risk? And could we intervene and ultimately prevent that individual's hip fracture? I think that there's evidence that regular physical activity programs have benefits for bone stock, for muscle strength and balance, to the point that they could be preventative from a future fall occurring. And then that person, and preventing that person from getting on a slippery slope after some sort of fracture. I mean, God forbid it's a hip fracture. I mean, still, but a wrist fracture or hitting their head, those are significantly consequential injuries also.
Yeah. Ultimately, I did the studies with Bobby Briggs and with Robin Marcus on hip fracture studies. That was a 3-year project that I worked on in my undergrad. And I had a friend that his dad, a really close friend, that his dad fell and broke his hip. And we were at a conference together it was almost 3 weeks ago in Orlando. And he said, yeah, my dad fell and broke his hip, and now he's got pneumonia. And I took a deep breath and I said, that was part of my project in school. Yeah. He's like, tell me everything.
Yeah.
And I said, are you prepared for what I'm going to tell you? I said, Brian, or my friend, I said, you should be with him, because the likelihood of him surviving this is really low. It is really sad. Once if they break their hip or have a fracture and then they get pneumonia on top of it, it is really low likelihood. But you're talking about what I love is what are we doing to prevent this before those things happen,
yep.
right? What can physical therapists do for balance? If our listeners have their grandma or their mom that has got balance issues, what can a PT do for them?
Balance disorders are multifactorial. So it could be a person has problems with blood pressure regulation. So we're trained to assess vital signs, and we could find out if a person has difficulty regulating their blood pressure upon standing. If that's the case, there's not a direct thing that we can do, but we can certainly be a conduit to talking to a medical provider that might be able to help with blood pressure regulation, and exercise may help with that also.
Absolutely.
But if a person has some sensory loss from aging or from diabetes, if they have, so that's like skin sensory loss on their feet, but they could also have declines in vision. Those things are two of the three sensations that help us maintain our balance. And if we can dig into that and find out what that person's individual issues are that are creating the balance problem, we can probably provide, at the very least, compensations to help them be better off from a sensory standpoint, or improve their function by muscle strength and other activities to make sure that they're functioning at their highest level and have better balance competence as well as confidence.
Yeah, so there's specific balance training that we do in the clinics, right? Yes. Because balance is just like a muscle.
Right.
It's, you work on it, it gets stronger. A lot of people think, oh, my balance is terrible just because I'm old. It's like, no, it's just because you don't practice it, right? And there are these components of vision and of what we call proprioception, understanding where your body's in space, and sensation in your feet as you walk. Yep. And these are all things PTs can screen, yep. right? That we can, and this is a great way to get engaged in the community. Go out to your senior centers, do some free balance assessments, yep. Where you're screening these things and get people to the right resources. If they have blood pressure issues, if they have vision issues, if they need their diabetes or peripheral neuropathy managed, we are centered on the front lines to be able to engage with that and direct people where they need to be, right. and prevent a lot of these big issues that are so terrible to watch. Your mom or your grandma breaks her hip. That is so painful to watch. It's so hard as a caregiver because it's so hard to recover from.
Right. I mean, you've already alluded to the fact that I have a kind of bias, not only from an exercise standpoint, but from a vestibular standpoint. I think it's a sensory system that is critical for balance and postural control, but it's also an area that we as physical therapists have a unique skill set to be able to offer care for acute issues, but also for maybe chronic issues. Interestingly, if you look at the kind of basic science research, the decline in vestibular function doesn't really occur dramatically until the 6th or 7th decades. So it's further on. But I would say that our vestibular our functional use of the vestibular system declines because we don't challenge it. That when you were a little kid, did you get on the swings and twist up the chains?
I still do that.
Okay, got it. If I do that now, I feel nauseated. We don't stress our vestibular system in the same way that we did when we were young.
Absolutely.
One of the interesting studies I've always wanted to try to do is to go to the senior games, the Huntsman Senior Games in St. George, and try to get the swimmers that are doing flip turns on a regular basis, or the divers that are doing these rotational stresses on a regular basis. So stressing their vestibular system repetitively as part of their training, and test their vestibular function versus somebody that remained inactive and isn't stressing their system. And I think what you'd likely see is that those individuals that are repetitively stressing their system are functioning optimally, and those individuals that are just disuse are subject to disuse, you lose it or use use it or lose it,
Yeah.
that those individuals are actually have decline in function, and that places them at risk for problems because they're not stressing the system.
And I hope if you're listening to this, you really caught what Dr. Dibble just said here, because the body is not like a machine. It doesn't just wear out to the degree that you think it does. The body adapts to the appropriate demands you place upon it. If you're not consistently challenging your vestibular system, a portion of your balance system, it gets weaker. But if you consistently challenge it appropriately over time, it gets stronger. Machines, when you stress them, typically wear out, right? When you stress your vestibular system appropriately, we got to remember that term, right? It gets stronger. So these people that are doing flips in the pool are essentially desensitizing and getting their vestibular system stronger and stronger to where they can adapt over time and be able to tolerate that motion more readily.
Correct.
And I love that. And that's really how the body works. You know, if you're not challenging it, you literally are going to, the body is meant to break down. It's meant to change based on it's adapting to what you're telling it to do. Right. It's a computer, you know? So as we wrap up, any other concluding thoughts on these topics? Any other things that you want to share?
I'll go back to what we started with, that physical therapists are on the front lines with interactions with individuals with a variety of conditions. We have the opportunity and the privilege of being engaged with those individuals, but also I think the responsibility of trying to enter into a partnership with them, not just for the episode of care. And I'm thinking about this in the kind of context of chronic disease, that we should be engaged in thinking about, okay, I'm going to be on the front lines of this person's journey with this disorder from their diagnosis or when I encounter them moving forward. We should not be shying away from the opportunity to really be a meaningful contributor to that person's health over the course of their life.
Absolutely. Well, thank you for your thoughts. And Lee, so much gratitude for you. You know, you were monumental in my work as a student, believing in me. I can't tell you how much I appreciate you and what you did for me throughout school. What you're doing today for our future generation of healthcare providers. What you do every day is making an immense difference for what the future of our health looks like. And thank you for all the heart, the dedication, the long hours, the effort that you put into it, because it's making an impact that will serve the society for hundreds of years. And I really believe that, because what you instilled in me is serving thousands of patients now through my practice and the patients that we serve. So thank you. And thanks for joining us today.
Yeah. You know, somebody told me that when people say compliments, you should not try to argue with them, but just say thank you. So I'm just going to say thank you.
You're welcome.
Okay.
Thanks for joining us,
Okay.
Lee.
Thanks.